Hi viewers, this is Dr. Bhuvaneswarri, Professor, IQAC Director, Department of Periodontics, Balaji Dental College. So today's topic is going to be on plaque control. Okay. So plaque control is generally divided into mechanical and chemical plaque control. So in our part 1 video, we are going to see on mechanical plaque control, and the first topic is going to be on brushing techniques. What is that? So brushing our teeth is an important part of our dental care routine. Okay, as ADA recommends, brush your teeth twice a day with a soft bristles toothbrush. Okay, so the size, shape of your brush and should fit your mouth and allowing you to reach the all areas easily. So replace your toothbrush every 3 or 4 months or sooner if the bristles are frayed out. Okay, our own toothbrush won't be good job for cleaning your teeth. So make sure to use an ADA specified fluoride toothpaste also. Okay, so what are the different types of brushing techniques? The bars or the circular cleaning method, modified bars technique, modified Stillman's technique, phones or circular scrub method technique, vertical or Leonard method, Charters method, scrub brush method, the rolls technique, and the physiological or the Smith method. Okay, so the bars technique, what is that? It is a circular cleaning method. It is most acceptable and effective method for removal of dental plaque present adjacent to and underneath the gingival margin where it is indicated. Okay, it is most adaptable for open interproximal areas, cervical areas beneath the height of contour of enamel, exposed root surfaces. It is recommended for patients with or without periodontal involvement. So the adjacent picture shows you how the bars method is done. Okay. So how to do this? Okay, the technique. The bristles are placed at a 45-degree angle to the gingiva and moved in small circular motions. Strokes are repeated around 20 times, 3 teeth at a time. Okay. On the lingual aspect of the anterior teeth, the brush is inserted vertically and the head of the brush is present into the gingival sulci and proximal surface at a 45-degree angulation. So the bristles are then activated. Okay. So the occlusal surfaces are cleaned by pressing the bristles firmly against the pit and fissures and then activating the bristles. Okay, next is what is the advantages and disadvantages of this bars method. Okay, advantages are effective method for removing plaque, provides good gingival stimulation and easy to learn. What are the disadvantages? Overzealous brushing may convert very short strokes into scrub technique of brushing and cause injury to the gingival margins. So this naturally causes a of over brushing will causes a gingival injury. Okay, so it is also time consuming and in certain patients the dexterity requirements is too high. So the next method is modified bars technique. So this is a common technique we recommend for all the patients. Okay, this method differs from bars technique in that it has a sweeping motion from the clavicular to incisal or the occlusal surface. So where it is indicated? So as a routine oral hygiene measure, it is a intracircular method of cleaning. So the advantages is excellent circular cleaning, good interproximal and gingival marginal cleaning, and good gingival stimulation occurs. When we are brushing the tooth, there will be a good stimulation to the gingiva. So the foremost disadvantage is dexterity with some of the patients. So this picture shows how the modified bars technique is done. The first picture shows toothbrush positioned on the facial and maxilloproximal surface of the maxillary molars. The second picture shows the palatal position on the molars and the premolars. So next, how we will do this technique? The technique combines the vibratory and the circular movement of the bars technique with sweeping motions of the roll techniques. The toothbrush is held in such a way that the bristles are placed against the 45-degree against the tooth. Okay, so the bristles are generally vibrated by moving the brush handle in back and forth motion. Okay, so the bristles are then swept over the sides of the teeth towards their occlusal surface in a single motions. So these three pictures, the first picture shows the brush is positioned on the occlusal surface used with the Bass, Tillman and Charters method. The second picture shows the palatal position on the incisors, and the third picture shows the how it is kept around 45-degree angulation in the intrasulcular area where the brush is positioned 45-degree angulation. Okay. The modified Stillman's technique. It is indicated in dental plaque removal from the clavicular areas below the height of the contour of the crown, okay, and from exposed interproximal areas, and cleaning tooth surfaces and for gingival massages. Okay, it is recommended for cleaning in areas with progressive gingival recession pressure. So, this technique is usually prescribed in patients who have multiple gingival recessions and also periodontally compromised patients. So, the main disadvantages are time consuming, and improper brushing can damage the epithelial, that is the junctional epithelial attachment of the gingiva. Okay. So, this picture shows how modified Stillman technique is done on the tooth. So, the sides of the bristles are pressed against the teeth and the gingiva while moving the brush with short back and forth strokes in coronal direction, that is upward direction. Okay. So, the technique how this is taking place. The bristles are pointed apically with an oblique angle to the long axis of the tooth. Okay. Then the bristles are positioned partly on the clavicular aspect of the tooth and partly on the adjacent gingiva. The bristles are activated with short back and forth motions and simultaneously in the coronal direction, that is the upward direction. So 20 strokes are applied and procedure is repeated systematically on adjacent tooth. Next is the Phones method or the circular motion method, where this is mostly prescribed in children's. Okay, it is commonly indicated in young children's, physically or emotionally handicapped individuals and patients who lack dexterity. Okay. So, how this technique is done? The child is asked to stretch his or her as such that they are parallel to the floor. Okay. The child is asked to draw big circles using whole arm in the air. Okay. So, the diameter of the circles is reduced until small circles are not formed in the front of the mouth. So, basically it is a circular motion of tooth brushing for the children. Okay. The child is now ready to make circles on the teeth with the toothbrush, making sure that all teeth and gums are covered. So, the advantages is it is easy to learn, shorter time is required. So, the possible trauma to the gingiva may occur if it is overly brushed and interdental areas are properly cleaned, and detrimental of adults, especially who use the brush vigorously. Next is vertical method, is the Leonard's method. The vertical stroke is used. Maxillary and mandibular teeth are brushed separately. Advantages: it is the most convenient and effective for small children with deciduous teeth. And the disadvantages are interdental space of the permanent teeth of the adults are not properly cleaned with this. So, the techniques are the bristles of the toothbrush are placed at 90 degrees to the facial surface of the teeth. With the teeth edge to edge, place a brush with filaments against the teeth at right angles to the long axis of the teeth. Okay, so the brush vigorously without great pressure with the stroke, which is mostly up and down the tooth surface with slight rotation or circular movements are given. Okay, after striking the gingival margin with the force. So, next is it is not intended to do the upper and lower teeth shall be brushed in the same series of strokes. So the teeth are placed edge to edge to keep the brush slipping over the occlusal or incisal surface. So the next method is Charter's method. So this is indicated in individuals having open interdental spaces with missing papilla and exposed root surfaces. So basically the interdental proximal layer papilla is recessed. Okay, those wearing fixed partial dentures or orthodontic appliances, these are basically indicated. For patients who have had periodontal surgery, patients with moderate interproximal gingival recession, this technique is indicated. So the technique is a small, soft or a medium multi-tufted toothbrush is indicated for this technique. Okay, the bristles are placed at an angle of 45 degree to the gingiva with the bristles directed coronally. Okay, the bristles are activated by mid vibratory strokes with bristles hence lying interproximally. The main advantages are massage and stimulation of the marginal and interdental gingiva happens here, and the brush ends do not engage in the gingival sulcus to remove the subgingival calculus. Okay, the correct brush placement is limited to or impossible, therefore the modification becomes necessary, which adds to the complexity of this procedure. So it requires in digital dexterity or eye in this case, in this method. So the next is the scrub brush method. Okay, this method of brushing requires vigorous horizontal, vertical and circular motions. It is the virtual freestyle of brushing technique. So the disadvantages are not very effective at plaque removal. Tooth abrasion and gingival recessions are common in this technique. So the picture shows you how the scrub method can be done on the tooth. So the rolls technique. This method of brushing is also known as rolling stroke method or ADA method or sweep method. It works fairly well for patients with anatomically normal gingival tissues. It is indicated in children's, adult patients with limited dexterity, useful for preparatory lesson for modified Stillman's technique since the initial brush placement is the same. So next is how to do this technique. The bristles are placed at a 45-degree angle. Toothbrush is rolled across the tooth surface towards the occlusal surface, and this technique requires some flexibility around the wrist. The advantages are it provides gingival massage and stimulation. Disadvantages are brushing too high during the initial placement can lacerate the alveolar mucosa. So it also causes a gingival injury. Physiological method or the Smith method. The physiological method was described by Smith and advocated later by Bell. Okay, it was based on the principle that toothbrush should follow the physiological pathway that is followed by food when it transverses over the tissue during mastication. So the bristles are pointed incisally or occlusally and then moved along and over the tooth surface and gingiva. Okay, next is the motion is gentle, sweeping from incisal or occlusal surface over the facial surface and the progressing towards and over the gingiva. So it is almost an attempt to duplicate nature's self-lensing mechanism. So the main advantages of this method is natural self-cleansing mechanism. Supragingival cleaning is good in this method. And the main disadvantages is the interdental spaces and subtler areas of the teeth are not properly cleaned in this method. So from this we are ending our brushing techniques topic. Now we have come to the end of our session. The part 2 video is going to be on interdental cleaning devices. Just let me know what's your favorite brushing method. Thanking you all.